You know, what if your body had a built-in warning system, a way to flag some really serious health issues, maybe long before you'd otherwise notice? Well, today we're going to be health detectives, and our main source of clues, it's one of the most incredible parts of your body, your eyes. So let's get into it.
I know, it sounds like something straight out of a mystery show, but this is 100% real science. Your eyes can offer these incredible insights into what's going on all over your body, from your immune system right down to your blood sugar. They're so much more than just the organs we see with. They're actually storytellers.
So, why the eyes? What's so special about them? Well, get this. They are the only place in your entire body where a doctor can look directly at your blood vessels and a major nerve, the optic nerve, just as they are. No surgery, no invasive procedures. This gives them this amazing real-time window into your circulatory and neurological health. It's kind of like having a living dashboard for your whole system.
All right, so our investigation is going to start with our first major clue, an eye that seems to be bulging or pushing forward. The clinical term for this is proptosis.
Now, we're not just talking about feeling a little puffy after a rough night's sleep. Proptosis is a noticeable physical change, where one or maybe both eyes actually protrude from their sockets. It is a big deal, and it's a sign that your body is trying to send you a very, very clear message.
So, what's the message? Well, a lot of the time, the culprit is an autoimmune condition called thyroid eye disease. This is basically where the body's own defense system gets confused. For reasons we don't fully get, it mistakes the tissue and muscles behind the eye for the thyroid gland it's supposed to be targeting. It's like friendly fire, causing all this inflammation and swelling that literally pushes the eyeball forward.
And a protruding eye, it almost never shows up alone. That same inflammation can cause the eyelids to pull back, which exposes more of the white part of the eye than you'd normally see. This can give someone this really distinct, kind of wide-eyed or startled look. These are all little pieces of the puzzle that point back to that same underlying issue.
You know, what doctors are often looking for is a pretty subtle difference between the two eyes, even if the change isn't super dramatic. A difference of just 2 or 3 millimeters and how much one eye sticks out compared to the other, that's a major red flag. It's this tiny little measurement that can point to a potentially huge problem with the thyroid.
Okay, so for our next clue, we're going to shift from the eye's position to its appearance. And I don't mean a simple case of pink eye. We're talking about a deep, persistent, and often pretty painful redness. It's a sign of something called scleritis, a serious inflammation of the sclera, which is that tough white wall of the eye. Now, a bunch of things can cause red eyes, but this specific kind of deep inflammation is often a major distress signal for a systemic autoimmune disease. And the most common one? Rheumatoid arthritis. In fact, for some people, a really stubborn case of scleritis is one of the very first signs that leads them to an RA diagnosis, a condition that's, as you know, famous for causing joint inflammation, especially in women.
Our third and final clue is going to take our investigation even deeper inside the eye, to a level you just can't see in the mirror. We're going to be looking at the microscopic blood vessels on the retina. That's the light-sensitive layer at the very, very back of your eye.
And right here, the stakes are just incredibly high. This statement from a leading ophthalmology textbook really hammers home how serious this is. The condition we're looking at now, diabetic retinopathy, is a massive public health issue.
So what's actually going on here? Well, at its core, diabetic retinopathy is a disease of the tiniest blood vessels. When blood sugar levels stay high for too long, they basically act like a poison, damaging the delicate walls of those retinal vessels. They get weak, and they start to leak blood and other fluids. That leakage can damage the retina, and over time, it can absolutely destroy your vision.
The really crucial thing to understand here is that a simple eye exam can spot this damage long before a person notices any changes to their sight. And the risk factors are pretty clear. The longer you've had diabetes and the worse your blood sugar control is, the higher your risk. Other things like high blood pressure or kidney disease, they just make the problem worse, faster.
So, our investigation has turned up 3 really distinct clues. We've got the protruding eye, the inflamed eye, and those leaky vessels. So now it's time to solve the case. What does this all mean for you? And how do we turn these clues into real, meaningful action?
We're really looking at a clear choice here. 2 different paths. On one path, we can just dismiss these signs. Oh, my eye looks a little different, or it's probably just eye strain. That can lead to a delayed diagnosis and sometimes irreversible damage. But on the other path, we actually listen to the warning. We see these signs for what they are, signals from our body. And that leads to early detection and proactive management, which always leads to better health in the long run.
So, what's your action plan? It's actually really simple. First, just notice. Pay attention to any new or persistent symptoms. Second, don't just brush them off. Take any change seriously, even if it seems small. Third, talk to a professional and don't put it off. And finally, always remember that deep connection between the health of your eyes and the health of your entire body.
And really, that's the big takeaway from our whole investigation today. Your eyes are not just for seeing the world around you, they're for seeing what's happening inside you. You got to think of them as that powerful, living dashboard for your health. Paying attention to the clues your eyes are giving you is a fantastic first step, and it leaves us with one last question to think about. What other secrets is your body trying to tell you right at this very moment?